Hi, I'm Brenda with the Hospice Care Plan. Let's talk VSED, voluntary stopping of eating and drinking. It is internationally accepted as ethical when somebody is at end of life with a terminal diagnosis, and it's as simple as it said. Somebody chooses to stop eating and drinking to shorten their life, and the beauty of it is it's a very fluid thing, and it gives people this sense of control. And it can be everything from not a drop in their mouth to having it be very fluid. I think I'll have a little cookie or a sip of something today. I think one of my favorite patients over time, Madge was her name, this was years ago, and for 3 weeks she would have a couple of sips of her latte in the morning, and then at night she would have a couple of sips of white wine, occasionally a little bite of cheese with it, depending on the day. And this went on for 3 weeks, and then she rather quickly went into her dying process. And I always think, Madge, that's the way I'm going to do it. But it's for people who are like, this has gone on too long. I don't want to, or I'm not in a state that allows medical assistance in dying. And it honors what the body naturally does in the dying process. It gets slower, eats less. The dying body likes to be dry and quiet and not have to work too hard. And so I think, and there's less confrontation from non-supporters of, some people think it's suicide, but it's not suicide. There does become an issue, and I'm seeing it more frequently, where people who have had just honestly a really tough life, whether it's due to a life of abuse, mental illness, chronic illness, but they aren't dying, and they want hospice to come on board and be supportive of them while they're voluntarily stop eating and drinking. And hospice can come on board, but not until they've gone far enough into their dying process to that they're now transitioning into dying. That is, unless, and now some people are on hospice who are already at end of life, and those are the people we mostly see who choose VSED, and they just slowly, naturally do that. And then some people are just more conscious of it and want to make it more formalized, and they'll post a note on their door to, don't offer food or fluid. And just honoring that, and also honoring if they change their mind in the moment and then go back to doing it again. Nancy's got a great story, one of her stories, about a guy named Ty that we both took care of. I first had him, and then she had him, and he went back and forth for months on voluntary stop eating and drinking. And I think that's the beauty of the system, is it's fluid, changeable, and it's always what the patient wants. I hope that was helpful, and you can look up in your local area, Google VSED, and give you more information on that. Thank you.